Okay, wonderful, wonderful. Well, good afternoon, everyone. My name is Serena Lowe, and I'm a Senior Policy Advisor to the Office of Disability Employment Policy within the U.S. Department of Labor. And it's my wonderful privilege to welcome you all to today's webinar, the first in a two-part series that we are hosting in collaboration with our colleagues at CMS. And we're delighted today to have our Assistant Secretary, Kathy Martinez, here to provide a few introductory remarks. So I'll turn it over to Assistant Secretary Martinez.
Thank you, Serena, and welcome everyone to today's webinar. We at ODEP are delighted to host this national dialogue, which will highlight some great policy advancements from our partners at the Centers for Medicare and Medicaid Services. We call them CMS. This is the first in a two-part webinar series that we're hosting to help state policymakers and disability stakeholders learn about recent CMS policy developments that can be used to inform and support state employment first systems change efforts. There are many parallels between health and employment for folks with disabilities. State Medicaid programs play a super critical role in supporting people with disabilities, in supporting folks with disabilities to live, work, and participate meaningfully in typical community settings. And that's why we've been working hard with our partners at CMS to find ways to collaborate on sharing information and leveraging technical resources. 2014, I would say, is a fantastic and exciting time as the Affordable Care Act implementation comes into full force, and ODEP is strongly committed to supporting CMS as it works toward implementation of this great act. We are pleased by the tremendous efforts of our colleagues at CMS to issue really strong policy guidance that reinforces the importance of providing services funded by state Medicaid in the most integrated settings possible. And hopefully, by the end of today's discussion, you'll have a really great sense of the various ways that states can use the myriad of state Medicaid plans and waiver options to promote integrated employment and community engagement for folks with disabilities. Now, I'm going to turn the program back over to Serena, and thank you all for attending, and I know you're going to learn a lot.
Thank you so much, Assistant Secretary Martinez. We're just really so blessed to have a wonderful leader who really gets the importance of cross-systems collaboration and makes us all walk our talk in terms of really coordinating efforts and reaching out to our partners across other federal agencies to do what we can to promote policies at the federal level and also at the state and local level that improve employment opportunities and socioeconomic advancement of citizens with disabilities. So thank you so much, Assistant Secretary Martinez, for getting us started. It's now my pleasure as the webinar facilitator to introduce our two colleagues who will be our key presenters today from the Centers for Medicare and Medicaid Services. Colleen Garuder has been employed with the Division of Long-Term Support Services and Supports at CMS since January of 2011 and serves as the division's subject matter expert on employment and also on the division's employment team. Prior to her work at CMS, she was employed with the State of Maryland's Developmental Disabilities Administration, where for many years she held the position of statewide coordinator for transition and employment services. During that her tenure at the State of Maryland, Colleen implemented several new programs and initiatives, including Employment First initiatives, self-employment initiatives, and fiscal incentive programs for employment of individuals with developmental and intellectual disabilities. She's also, prior to her state employment, she has worked with an array of community service providers and even formerly as a director of supported living and senior and employment coordinator. So she's really walked in many of the shoes of the professionals who are on the call today at a state level and also at a provider level. So I think she's going to have a great perspective in how you can utilize various state waiver and Medicaid plan options to really further your own systems change efforts on the ground to increase employment opportunities for individuals with significant disabilities. Our second presenter from CMS is Jeff Clopine, and Jeff has been employed with CMS in the Division of Community Systems Transformation since June of 2010. He is the CMS Project Officer for the Medicaid Infrastructure Grant Program and the Money Follows the Person Grant Program. And he works with a team of folks at CMS who oversees and monitors the NFP program and several states for the MIGs. He's also a member of the CMS Employment Workforce Team as well. Prior to his tenure at CMS, he was with one of our other federal colleagues, U.S. Department of Education's Rehabilitation Services Administration for 4 years. So he also brings a really strong, entrenched policy expertise to the table in how these various federal policies and systems can interact and engage to further employment and economic advancement of citizens with disabilities. So on that note, I just want to echo Assistant Secretary Martinez's point and really show our gratitude to our colleagues at CMS who have been working tirelessly on a number of policy development initiatives and also to provide support to states who are really trying to shift the focus of their Medicaid funds for long-term supports and services for individuals with disabilities to make sure that they are in the most integrated setting and that folks really have an opportunity to succeed and achieve their American dreams within typical community settings like the rest of us. So we're very proud partners of CMS and of both Colleen and Jeff specifically and appreciate their time today. And with that, I'm happy to turn it over to our colleagues.
It's a pleasure to be here with you today, and thank you so much to Assistant Secretary Martinez for her opening remarks and to Serena for arranging this webinar. We're very excited to share the information that we have with you today, and we'll allow plenty of time for questions and answers. Any questions that we're not able to answer today, we will get back with you on. And we'll make those arrangements through Serena. I wanted to just take a minute to remind folks about the purpose of this particular webinar, which is to share information with you about the various Medicaid authorities that exist to support employment for people with disabilities and the elderly, and also to provide information on various different grant programs that we have through CMS that also further the goals of employment outcomes for people with disabilities. The purpose of this webinar is not to talk about the home and community-based settings rule, which I'm sure you're all very eager and anxious to hear about. That will be next week's call with my supervisor, Ralph Lawler. So stay tuned for that information. Jeff and I are not prepared to talk about that particular subject today, and that information will be coming to you next week. So I just wanted to clarify what the purpose of today's webinar is. So there are various different Medicaid authorities that support employment, including 1915C Home and Community-Based Waiver Services, which is a service that probably the majority of you on the phone are the most familiar with. We have approximately 340 1915C waivers across the country. I would say a little less than 100% of them include some type of support in employment settings, either day hab, pre-vocational, supported employment, career planning, but the majority of waivers that we support through our work do include some type of employment type of services. We're also going to touch base on the 1915I state plan option for home and community-based services, the 1915J, the 1915K, and we could go on through the alphabet, right, all the way to Z, but we're not going to today. That's for another day. And we're going to talk also a little bit about 1115 demonstrations and how the 1115 demonstration work ties into employment services as well. So I'm going to go ahead and advance the slides now. The 1915C Home and Community-Based Waiver Services were established in 1981, and they provide home and community-based services to individuals who require an institutional level of care, so either nursing facility, ICF, IIDD, or a hospital level of care. The 1915C allows the option to offer various services, including habilitation, which may also include day hab, pre-vocational, individual supported employment, group supported employment, and career planning. On September 16th, 2011, CMS put out a informational bulletin to all of its stakeholders regarding employment supports and services, and I wanted to go over some of the highlights of the informational bulletin because that informational bulletin is our latest policy on employment supports. So if you don't have a copy of that 9/11 bulletin, informational bulletin, make sure you get your hands on a copy of it, and you can get that through going to Medicaid.gov and doing a search of informational bulletin 9/16/11, and that is really the impetus for our discussion today and sort of the kickoff point for our discussion today. So the informational bulletin, which provides technical guidance to states, underscores CMS's commitment to the importance of work for waiver participants. We believe that all participants with disabilities, regardless of the severity of their disability, can work and should be supplied with the supports that they need in order to achieve employment outcomes. It supports states' efforts to increase employment opportunities and meaningful community integration for waiver participants. We recognize that there are, let's see, how many of you are there on the phone right now? I would say there are probably close to 300 people on the phone right now, 314 participants so far on the phone now. Of you probably representing around 30 or so states. There's also another technical assistance opportunity that's available to states through the National Association of State Directors of Developmental Disability Services, which also offers similar types of technical assistance to about 27 other states. All told, I think just about every state in the nation is covered with some type of assistance for furthering your employment first goals. So we're hopeful that this informational bulletin actually supports your efforts in furthering employment outcomes for people. It also provides further clarification of CMS guidance regarding several of the core definitions and adds several new core service definitions. So we have in our technical guide currently several core service definitions such as day habilitation, pre-vocational, and supported employment. And what we did is elaborated on those definitions, either adding some clarification to some of them or adding additional service definitions so that states have a little bit more flexibility in the way that they're providing services to people. The Informational Bulletin provides a strong preamble that highlights the importance of competitive work and CMS's goal to promote more integrated employment options and waivers. So in states work with analysts at CMS when you're submitting an amendment or a renewal or an 1115 or a 1915B or a 1915I, we will have the conversation with you about employment. Employment is high on our radar screen. It's a high priority for us, and we want to make sure that this informational bulletin that I'm talking about is enforced the way it should be. It's intended to provide you with guidance on how you could create your core service definition. You could either use CMS's core service definition, or you could create your own, as long as you have the tenets of CMS's core service definitions within your own service definition. So we allow you a bit of flexibility in how you actually word your core service definitions, but knowing that you need to continue to follow CMS's policy on what needs to be included in each of those service definitions. The other thing the Informational Bulletin does is it emphasizes the critical role of person-centered planning in achieving employment outcomes. I think everyone on the phone probably believes and feels the same way that we do here at CMS, and that is that good person-centered planning leads to a good job and a sustaining job, not just any job. So the better a job we do with person-centered planning and really getting at the bottom line of what the person's skills and interests and strengths are, the better the job developers or the employment specialists or whatever you call them in your state can do in actually developing a job for an individual. So person-centered planning is at the heart of everything that we talk about here today. It articulates best practices and highlights self-direction options for employment support. So we talk a little bit in the bulletin about self-direction as being a really key element to employment supports for people who want to self-direct their own services. Employment is certainly a service that could be self-directed for folks. It explains that the ticket-to-work outcome and milestone payments are not in conflict with payment for Medicaid services rendered. So that basically means that providers that choose to become an employment network through the ticket-to-work opportunity can also receive a CMS Medicaid payment for a day of service without it being a conflict. And the reason is because the ticket-to-work is an outcome-based payment, and the services for Medicaid are paid for services rendered. We got attorney input on that, and so we got clarification that that is allowable. So if that helps to support you in any way in terms of increasing the finances that are coming into your agency by becoming an employment network, by all means consider that because again, it's not in conflict at all, and we would support it certainly. It clarifies that pre-vocational services are not an endpoint, but a time-limited activity to help someone obtain competitive employment. And you may notice in the Informational Bulletin that we don't give a specific timeline. We leave that up to states to decide. But the bottom line is that it's up to the individual's person-centered plan as to how long they would be in a pre-vocational service. Gone are the days where people were in pre-vocational services for 20, 30 years with the hopes, and I use hope with a little h, of getting a job out in the real world. That's simply not acceptable anymore. The purpose of pre-vocational is that the pre means that there's something else coming that's bigger and better, and we see that as competitive employment. So the purpose of pre-vocational services is really not that the person gets stuck in limbo in pre-vocational services for the rest of their lives and perhaps served in a sheltered workshop but rather that they are gaining some short-term goals and skills that they need to move on to a job in the community. The Informational Bulletin describes that volunteer work and other work-type activities that are not paid, integrated community employment, are appropriately classified as pre-vocational and not supported employment services. So let me say that again, because that's really important, because some states do have volunteer work in their definition of supported employment. So I just want to remind you, volunteer work and other related work that are not paid, integrated community employment, are pre-vocational services and not considered supported employment services. We recognize that there's an importance, certainly, for volunteer work. I think there's probably, out of the 315 or so of us that are together today, probably the large majority of us spent a little bit of time, at least, volunteering in a job or two before we landed our dream job or our job that we're currently in. And so we recognize that it's very important for people to have the opportunity for volunteer work. We just don't want to classify it as supported employment any longer because the person's not making minimum wage. So the other thing that the Informational Bulletin does is it splits supported employment into two core service definitions, individual and small group. For individual supported employment, it's expected that the individual will make minimum wage or more, and that they'll be compensated at the same rate as those individuals that are not that do not have disabilities. For small group, it's for between 2 to 8 people, and we are looking at that being a training type of activity, if you will, that sort of is a jumping-off point for someone to get a job, an individual job in the community. Again, small group employment is not meant to be a forever type of situation. It's meant to be a training opportunity that people move on to and move on to individual competitive employment. We also added a new service definition for career planning. We heard from various different associations and stakeholders that they felt like career planning was an important enough category that it could stand alone as a service category, or it could be combined with other service categories such as day habilitation, pre-vocational, and supported employment services. So you can use career planning either by bundling it into one of the other services that I mentioned, or it could be a standalone service. But we felt that it was very important to include career planning in our variety of services that are offered through CMS, because obviously good career planning leads to a good job as well. So CMS is not changing policy through this informational bulletin, but rather we're clarifying and strengthening the guidance around permissible waiver options to promote employment for people with disabilities and individuals who are elderly. There's a link in your PowerPoint presentation to the bulletin, informational bulletin that I mentioned, and I just wanted to also mention that these changes that were made in the informational bulletin will also be included in the 3.6 version of the waiver technical guide to be released at a later date. And I can tell you that at this point that date seems to be coming later and later because we've now rolled out this massive rule on home and community-based services, which is consuming quite a bit of our time right now. So it's coming, it will come, but in the meantime, you have this informational bulletin that you can lean on for guidance. Section 1915I, state plan option, is an opportunity to provide home and community-based services for individuals with disabilities. It was modified through Section 2402 of the Affordable Care Act to allow states to expand access to home and community-based services without requiring an institutional level of care for enrollees. So that's probably the most critical distinguishing factor between a 1959 and 1915C is that individuals don't need to meet an institutional level of care. So far, we have 16 approved 1915I HCBS state plans, and services include such services, for example, supported employment, career planning. We've seen some pre-vocational services, but this is a really good opportunity for expanding services to the mental health population. It's a great fit for that population. It allows you to provide employment services and supports for that population. 1915Cs are a little bit tricky when it comes to serving the mental health population because there's such a thing called an IMD exclusion that sort of gets in the way of providing the 1915C services, but not that they're not provided, but we don't see them quite to the same extent that we do in the 1915I. So I would just point that out. And the other population that the 1915I has been particularly helpful with is the transitioning youth, the people with severe emotional disturbance. That particular population, we've also seen some eyes on those as well, and it seems to be a good fit for that population as well. Medicaid infrastructure grantees who are working with states as they develop 1915I options, you will be talking with your MIG coordinator, if they're still around. I'm looking at Jeff. I think they're still around as a result of a no-cost extension, to help integrate employment-supported policies and support. So we're really, CMS is looking at every opportunity we possibly can to integrate employment into all of the work that we do. So 1959 is another example. 1915J is Self-Directed Personal Assistance Services, or PASS. It's a state plan option that was effective on January 2007. It provides a new state plan participant-directed option for individuals receiving services under state plan personal care services, benefits, and/or a 1915C HCBS waiver service. Personal care and related services could include home and community-based services under an approved Section 1915C waiver program, such as supported employment, and at the state's discretion, items that increase an individual's independence or substitute for human assistance to the extent that expenditures would otherwise be made for human assistance, including additional goods, supports, services, and supplies. 1915K, which has been hot in the press lately because it goes along with the 1959, the 1915C, and the new HCBS rule that was rolled out recently. 1915K is a provision of the Affordable Care Act called Community First Choice Option. It includes a 6% enhanced federal matching funds, which a lot of states like to hear. So if you're looking for sources of money, here's a source of money for you to enhance your employment programs. The 1915K has to be offered statewide in the community, not in institutions, and the benefit can be used to support individuals' employment goals. Currently, there are 2 states that are approved, California and Oregon, and I just got an update today, and it's still 2. We have one that's being considered now that's pending, but it hasn't been approved yet. 1115 is a demonstration through Medicaid, and it's for the purpose of research and demonstration projects. It authorizes the Department of Health and Human Services Secretary to consider and approve experimental pilot and demonstration projects. There are many, many states that have 1115s now, and they have been on the rise. Many states are looking to collapse all of their 1915C waivers and move them into an 1115, or they're looking for 1115 authority, expenditure authority, to serve underserved or unserved populations, Medicaid populations. Services may include supported employment, career planning, And as states are having conversations with CMS analysts, you will have a conversation, expect a conversation about employment supports. Again, we're making sure that we're threading employment through all of our discussions on all the various different authorities that we offer. And with that, I'm going to turn it over to Jeff now.
Good afternoon, everyone. It's a pleasure to be with you all this afternoon. I'm going to be talking about 3 programs listed on your screen. Before we do that, Colleen mentioned earlier about the Medicaid Infrastructure Grant. That grant has ended in 2012, and there was a number of states last year that asked for a no-cost extension, which ended in December of 2013. So 44 out of 50 states who started out with the Medicaid Infrastructure Grant over 10 years ago do have a sustainability plan in place where the Medicaid Infrastructure Grant is still going on at some level, at some capacity in your state. So if any of you want to look into your state contacts as to where they are with the Medicaid Infrastructure Grants, feel free to contact your representatives. Okay, I'm going to talk about the Medicaid BuyIn program. Basically, this program was approved through the Budget Act of 1997, the Balanced Budget Act of 1997, the Ticket to Work Incentive Improvement Act of 1999. This program really gave the opportunity to allow individuals with disability to work and access to Medicaid benefits and earn more than otherwise be possible while enrolled in the traditional Medicaid. Being able to buy into the Medicaid insurance while they're working so that they don't lose their benefits. Typically, the states allow the individual to buy into the Medicaid program by paying the premiums that are based on their income. 46 states operate the Medicaid BuyIn program, and there are approximately about 200,000 Medicaid BuyIn enrollees nationally, and a high percentage of them are Medicare beneficiaries as well. So quite a few of those people are dual eligible for Medicare and Medicaid. In states that have the option to eliminate income and assets and resource limitations, it really depends on the state and how they are set up, and they have to amend their policy through CMS in order to get that approval. Medicaid BuyIn members, they do rely on critical community long-term care services such as personal attendant services, durable medical equipment, and other home and community-based services to stabilize their health and support employment through the activities of daily living, which may not otherwise be covered through the payer sources of other health insurance. On the average, the Medicaid BuyIn members have lower costs for service expenditures than individuals with disabilities on the traditional Medicaid, so it does save some money on a national level. The next section I'm going to be talking about, which is the area of my expertise. I've been working with the Money Follows the Person program for 4 years now. I am the project officer for 8 states. Currently, there are 44 states, including the District of Columbia, who participate in the Money Follows the Person program. Originally authorized in Section 6071 of the Deficit Reduction Act of 2005, which originally provided the $1.75 billion over 5 years through the awards in 2011. And when the Affordable Care Act came along, it amended the Deficit Reduction Act and provided an additional $2.25 billion through federal fiscal year 2016. And what happened there, when we get to 2016, which is not far from now, but any unused amount of money that's left over which, by the way, is a $4 billion program when you add the two together, will be disseminated to the states in 2016. And what will happen is that they will be providing us a budget that will carry them until 2017, which will be in December of 2017, the last day that they can transition someone from an institution to a community setting, with a year follow-up of 365 days to 2018. And then 2019 and 20 is mainly a closeout period to close out the grant. So having said that, the Money Follows the Person program does provide numerous opportunities for states to promote and support employment through program administration of policies and services. States also have an opportunity to rebalance funds to support employment-related services and activities. The Money Follows the Person program is we call it a rebalancing program. It's to rebalance how states are utilizing the Medicaid funds for individuals who are institutionalized in nursing facilities and ICF facilities, where there's a major trend, a major thought-thinking trend process to change the way how individuals who may be in nursing facilities could benefit much better in a home and community-based setting. And we recognize every individual is unique and different in many ways, depending on what services that is needed for them to be successful in the community. The Money Follows the Person program has several state investments using rebalancing funds. What that means is the rebalancing fund, the amount of transitions that the state accomplishes, the difference between the facility-based costs versus home and community-based costs, there's a savings in between there, and that's what's called rebalancing fund. It's the amount of money states are saving when they're transitioning individuals out of institutions into the community. And that is what we call that state money. It becomes state money, but they can only use that so-called extra savings when they transition someone from the facility into the community. And that allows unique opportunities for states to increase waiver slots, where there might be a waiting list in many areas. This rebalancing fund kind of relieves that waiting list and allows opportunity to allow for more slots. It also allows for development of needs assessment tools and increases community service capacity, including employment services. Colin mentioned earlier about employment being on the radar, and yes, it's very much on the radar. It's a very hot topic right now here at CMS, and with our collaboration with Serena and her staff at ODEP, we're really trying to work together as a team to share information and to share ways to increase employment outcomes for people with disabilities. The Money Follows the Person program does employ the opportunity for states to hire employment specialists on staff, benefits counseling, the support employment home community-based services specialists, and on this slide, you'll see that there's a web link that has our employment policy that we have created within the MFP program that kind of lines up what MFP can pay and what the home and community-based services can pay, and then kind of cross each other systematically to kind of share resources. So when you all have a chance to take a look at that policy, and feel free to contact us on that. Going to the next slide. The next program I'm going to be talking about is another grant program called the Balancing Incentive Program. I'm not an expert in this area, but I'm here to share the information At the end of the slide, there's contact information. An individual who's on there is Effie George. She is the project officer, along with Carrie Rita, who is also working with Effie on the Balancing Incentive Program. So I'm going to share information. So if anybody has any questions, I'll do the best I can, but I may not. We'll certainly be able to take the questions and get back to you. But really, the Balancing Incentive Program authorizes CMS to provide financial incentives to states. It's really the goal to increase access to non-institutionally based long-term services and supports. The participating states are required to make the following structural reforms in the areas of no wrong door, single entry point system, conflict-free case management, and core standardized assessment instruments. Total funding is not to exceed $3 billion in federal matching payments. The Balancing Incentive Program also transforms long-term care systems. This program actually started in 2011, and it has a variety of areas that will lower costs through the improved system performance and efficiency, help create tools to help consumers with care planning and assessment, along with quality measurement and oversight. The Balancing Incentive Program also provides new ways to serve more people in home and community-based settings, and keeping with integrating mandate of the Americans with Disabilities Act as required by the Olmstead decision. And regarding the Balancing Incentive Program, it's really some technical terms here, but really it's to help make structural reform to increase nursing home diversions and access to non-institutional long-term support services. And the way it is the states are getting enhanced match, and they are tied to the percentage of the state long-term support services spending mechanism. With a lower FMAP, the increases going to states will help make fewer reforms. Total funding over 4 years from October 2011 to September 2015 cannot exceed $3 billion in federal enhanced matching payments. And there's a website that I included on there that it gives a lot of good insights, and certainly you can email us for any questions. The next area I'm going to be talking about is supported employment for people with significant mental health conditions. Basically, the current picture here, as we see it, is that people with mental illness have unemployment rates beyond 80%, yet more than two-thirds report that they want to work. Day treatment and psychosocial rehab services comprise a significant percent of state mental health spending. Virtually, all state mental health spending on day services. And according to 2011 SAMHSA data, only 1.7% of the people served by state mental health agencies receive any type of supported employment services. There's a benefit design in this area. The descriptions of the typical service components, including assessment, supportive counseling, benefits planning and assistance, job development, and on-job supports. And the case for supported employment, there's as you see on your screen, there's a variety of bullet point areas that plays a major role for supported employment. As many of you may know, but we have it highlighted on this screen. It's improvement in mental health functioning, improved clinical outcomes, reduces inpatient psychiatric admissions, reduced use of psychiatric crisis services, increases attendance at regularly scheduled mental health appointments, improve employment outcomes, as we all like to see that. That's certainly a key role is for individuals, I think for any disability, having an employment outcome makes a huge difference. High rates of placement and comparative employment, higher salaries, creates an opportunity for higher number of hours worked, higher rates of job retention, and higher levels of job satisfaction. So that concludes what we have for today, and certainly I believe there is a question and answer session, and if Serena wants to jump in to see how we can go from here, we'll be glad to help you out.
Absolutely. I just want to thank Jeff, you and Colleen again for a very thorough and comprehensive presentation and overview of a number of state waiver and plan options and other initiatives that states can take advantage of through their state Medicaid agencies and supportive sub-agencies to really promote integrated employment options for individuals with significant disabilities. So that was a wonderful overview. We are going to jump right into a Q&A session. In order to preserve the quality, sound quality of the phone, we will be taking questions via the chat feature. So those of you that registered for today's webinar and are participating, as you have questions, please feel free to submit them. Many of you submitted several questions during the registration process, so I have several, and I'm going to take the liberty of just facilitating a conversation with Jeff and Colleen based on those questions first, and then as other questions percolate, we'll take those as well. One of the first questions that we had, and I'm going to kind of scatter all over the place so that we are able to capture diverse interests in the various options and initiatives that you all spoke to. We did receive a number of questions on 1915C, and so I'd like to start with our first question, which is how can states comply with federal regulations and simultaneously adopt a policy of no new entrants to facility-based pre-vocational services for existing 1915C waivers? Colleen, can you take that for us?
Yeah, I'll take it and I'll punt it. Actually, that's an area that we're looking at. We've had, so far, one state has come into us with a proposal to do just that, and that is to close the front door to all new entrants. In particular, this one state has closed the front door to shelter workshops for transitioning youth, which I think was a very smart strategic move on their behalf. But we're trying to figure out policy-wise how we can make that happen smoothly so that it doesn't become a waiver within a waiver. So, for example, all waiver services must be available to all waiver participants. So by saying that certain participants can't participate in pre-vocational services and that's the service that's typically offered in the shelter workshop, then you are excluding that group from being able to access the services. So we are looking at the policy on how to make that happen. And I am guessing that the policy will come out relatively shortly because obviously we have home and community-based settings rule that's hot on the trail that will be effective on March 17th, and folks are going to need guidance on that. So we are working on that, but we're just not at a point where we're ready to give folks guidance on that just yet.
Great. So for states that are looking at that, would you recommend that they reach out to CMS or to have a conversation in advance?
Yes, definitely. And I'm always open to having states contact me, state employment coordinators contact me and talk with me about their ideas for what they want to do with their employment services. So if you're grappling with, let's say, offering career planning as a standalone service versus bundling it in with other services, I'm happy to have that conversation with states. Sometimes it helps to just talk through your ideas and to know that CMS is supportive of your ideas before you put them down in writing and then submit it to us for approval.
Wonderful. Thank you for that. I'm sure there are many enthusiastic participants on today's webinar who will take full advantage of that opportunity. One of our next questions is something that comes up quite frequently in a number of our conversations from ODEP's standpoint, and it's related to personal care assistance. And we have a question here from one state. They're very interested in getting some clarification and even some ideas on creative strategies that states are using to allow personal care assistance services to assist people in the workplace. Could you share some light on that as well?
Sure. I've seen some examples of personal care assistance being used in addition to a job coach for the purpose of personal care tasks. So, for example, the personal care attendant may go to the individual's home, help them get prepared for work for the day, help them get dressed, help them get up, and help them access the transportation that they need to get to work, and then meet them on the job site at a later time, let's say at like 12 o'clock, 11 o'clock, 12 o'clock, or whatever, for a break, a bathroom break, feeding that needs to occur, any changing that needs to occur, positioning that needs to occur, that kind of thing. So we have seen some of that in waivers.
And that's completely allowable by CMS, correct?
Yes, that's allowable by CMS.
Great. Our next question.
Serena, let me just clarify that it can be a component of a certain service, like a pre-vocational service or a supported employment service, but it can't comprise the entire service. So you can have as part of your, let's say, for example, it's a supported employment service, you could have as a subcomponent personal care attendant services for, X amount of hours of the day, and then job coaching services for X amount of hours of the day. It gets a little tricky when states have daily billing, because then it's not as easy to break up the day into different billing units. Mm-hmm. But it certainly can be done from a policy perspective. Okay.
That's very helpful. Thank you for clarifying that. Our next question is with respect to career planning, and I'm just going to read it from one of our participants from the great state of Iowa. I understand career planning services would include discussions, assessments, etc., to identify one's career plan, but can career planning services also include financial planning services, work incentives advisement, etc.?
Certainly. States can build their services to include just about anything under the other category, and career planning would be a service that falls under the other category. So you could absolutely build in work incentives planning into that particular service, and also work incentives could potentially be a standalone service that states offer in their waivers. Although I have to say that we will ask the question, is it available through other means first and foremost, such as through the WIPAs, the local WIPAs, but if it's not available or if there's a lack of resources, then by all means financial planning and work incentives planning could certainly be considered a 1915C service within career planning or as a standalone.
Thank you for that. That's very helpful. Another question that we had was with respect to the infusing or braiding of resources, HCBS services and resources across systems, and in this case with respect to vocational rehabilitation. Can you discuss a bit how HCBS services can support and integrate but not supplant VR services, and how you've seen that interplay with various states?
Yes, and let me tell you that that's the $10 million question, how to do that successfully. And if we had the answer to that, I don't think any of us would need a job. And it's interesting because Jeff comes from the VR system, and I come from the IIDD system, and we work collaboratively, and we put our heads together and can't figure it out either. But no, all kidding aside, the purpose of VR services, as I understand them, and Jeff will correct me if I'm wrong, is to provide the short-term, upfront job coaching and job development that a person might need to obtain a job. The purpose of 1915C or 1915I services would be the long-term sustaining of a job, sustainability of a job. So VR should be used up front first and foremost, and then there's a handoff naturally to either the IIDD system, the mental health system, or any other system that is providing employment services to people long-term, to provide the long-term job coaching. And I can give you an example of a best practice that's out there, that the best one that I've seen so far in my career at CMS, and it's not just because I'm from Maryland, and a shout out to all my Maryland friends out there, but the Maryland VR and mental health system have a really good working relationship. They even share a database, a computer database, whereas it's a single point of entry. Folks can access either or service by entering that portal, and then there is really good tracking of who's paying for what. So who's paying for job coaching on any given day, and who's paying for job development on any given day, et cetera, et cetera. And again, that's through the Mental Hygiene Administration at the state of Maryland and the VR department in the state of Maryland. In fact, I know that there was a paper that was written, and I apologize that I don't have the citation for it, but perhaps if you Google VR and mental health systems, you might be able to come up with that paper. The contact person in Maryland, I know he'll shoot me if he knows that I'm spreading his name around, is Steve Reeder, R-E-E-D-E-R. And he's the person that really put his heart and soul into creating that program. So he's very knowledgeable, and I'm sure he would be happy to share his expertise with folks.
We also have an adoration club over here at ODEP of Maryland's system, and of Steve Reeder in particular, who is a subject matter expert for us on our Employment First State Leadership Mentoring Program. But we also have that citation, and so we can send that around to folks who are interested in that and learning more. The next question I have is related to the Balanced Incentives Program grants, and so I'll turn it over to Jeff for this one. But for the BIP grants, how are they supporting employment systems change from facility to community-based services? It seems to me that all these employment services are already under the HCBS side of BIP. Can you all help clarify for us?
Well, my understanding is the way the Balancing Incentive Program works is, number one, it's supposed to bring down the Medicaid spending for states that are spending over 50%. It's supposed to bring down the level of spending. As far as and I know that's not the answer you're looking for, but I think in relating to the question whether or not they are connected to HCBS side, BIP is really supposed to be a mechanism to assist with any areas that may not be covered. And I'm not saying, and I might not be saying it that in the right manner, but that my understanding is it's really to help facilitate states on the areas of the no wrong door and the career planning aspect of it. And I think if you go on to the website, there is a question and answer area, and if we can't, to really be honest with you, I don't have an answer for that. I don't know off the top of my head because it's really not my expertise area. But if you can, I can get this question answered through Effie and Carrie, who run the BIP grant, and I can certainly, whoever, I see the question on the screen. I'll certainly be glad to get that answer for you.
Great, and in follow-up to that, I know that one question that we get a lot or interest in is states who are looking at the BIP or who are already receiving a BIP grant. They're very interested in terms of its correlation with employment, looking at how some of the structural reforms that are required under the BIP can be used to help support their employment transformation efforts. And one of the key structural reforms, I believe, Jeff, is that the state has to introduce policies to promote conflict-free case management across the board so that individuals aren't being counseled about their options from the same folks that are providing the services, and to kind of create some independent and ethical processes with that. And so when you follow up with them, and I'll send pass these questions along, it would be great to get some additional clarification or information on strategies that existing BIP grantees have put into place to really make sure that on the employment and day side of service delivery that's financed through Medicaid, that there's a conflict-free case management protocol in place.
I can tell you, this is Colleen from my perspective. I work with a couple of BIP states, and Effie George, who is the BIP project officer, will bring up employment as part of the dialogue, absolutely, as part of the dialogue for states that are investing in, or reinvesting in, I should say, community-based services. So you can expect to have that conversation with Effie and or Kara, depending on which project officer you reach. Just as part of the conversation that we're having, when we're talking about the institutionalization of people, we're not just talking about where they live, we're talking about where they work as well.
Great point. Excellent point. Another question we have is around the topic of transportation, and we know at ODEP that this is really an ongoing challenge for states grappling with trying to ensure full wraparound supports for individuals and to ensure their ability to participate in integrated employment and other aspects of life, so of community living. This question is as follows. Transportation is a big issue for getting people to and from their jobs. Can we continue to have travel reimbursement for those who are needing assistance with transportation? Can you speak a little bit to how the different waiver and plan options can be used to support the transition needs or the transportation needs of individuals with disabilities?
Sure. Within the waiver, oftentimes people link transportation with the service that they're providing. So if you receive day habilitation or pre-vocational or supported employment services, transportation is part of the rate. That's not always the case. Sometimes states provide transportation as a separate service outside of a bundle, which is fine as well. The other thing that we've seen some states get creative with is paying for bus vouchers, paying for taxi fares. People who are self-directing could pay a neighbor to provide transportation for them to and from work, or a coworker, et cetera, et cetera. I think the thing that you have to be careful with is that the provider is not billing the individual for transportation and accepting Medicaid payments at the same time for transportation. Because once you accept the Medicaid payment, it's a payment in full, and if it includes transportation in the rate, you cannot bill individuals separately for transportation. So I just wanted to throw that in there because I know that happens in states sometimes.
Boy, that's a great cautionary note for a lot of folks, both states and providers of services, many of whom are on the phone, as well as disability advocates. So thanks for making that clarification. I want to talk about outcomes for a little bit. As we've talked behind the scenes, I know you guys are getting a lot of great questions about whether or not rates can be tied to some type of performance-based tiered payment system or outcome system. So we received a question that I think really speaks to this. Can rates be developed based on outcomes, such as quantity of work achieved and amount of employer-funded benefits received? I know you guys this is an ongoing dialogue for you internally, but could you speak a little bit to the issue around for states who are wanting to try to tie and attach their rates or payments to specific milestones or outcomes?
Sure. This is an ongoing question that's becoming more and more popular, which actually we think is a great thing. As you know, Medicare pays for outcomes. Medicare billing is very different than Medicaid billing, where we're paying for a service. However, there is some wiggle room within the current CMS technical guidance, policy in other words, that would allow a state to build a rate structure that is outcome-based. You could do it through a number of different ways. Either you could have the service, and let's use supported employment as an example. For supported employment, you may have an outcome that is a career plan is developed. So you have a career plan in hand. You get a milestone payment for that. A job is developed. You get a milestone payment for that. The person increases their work hours. You give them a milestone payment for that. They increase their earnings. You give them a milestone payment for that. Whatever. I'm just throwing out random outcomes that could be possible. You could either bill that as subcomponents underneath your supported employment rate. So for individual supported employment, under that particular billing code, you would have subcomponents that would list out the various different outcomes. Or you could also bill the outcomes under supplemental payments, which is an option that is in Appendix I of the waiver. And you could bill them as supplemental payments. The one cautionary thing that I want to throw out there to the wind here is that when states are coming into CMS with proposals to pay for outcomes versus services, we're going to ask some really hard questions about what are your qualifiers? What are the quality standards for each of the outcomes that you've established? What has your state looked at in terms of can it be any job that a person gets, for example, or does it have to be a job that the person is interested in or that the person chose? Can it be any wage? Does it have to be minimum wage at a minimum? That's a qualifier there, that it has to be minimum wage or higher. So we're going to be looking for you to give us a proposal on how you're going to lay out the program pretty specifically in terms of providing an outcome-based payment system. It's not just as simple as listing the outcomes 1, 2, 3, 4. We want to know, how'd you get there? What kind of conversations did you have to bring you to the point of selecting those particular outcomes over other outcomes, and what qualifiers did you discuss?
Great, thank you for that. I think there's a lot of states that are really interested in this, but as you know better than anyone, it's a very complex effort to do this, and I think folks will need some additional opportunities to get feedback from CMS along the way. So thank you for that. The other thing that, one question we had is that on your slide 8, and I'm not entirely sure what that one is. Hold on a second. On slide 8, related to the 1915C waiver technical guidance revisions, I think it is on, it mentioned other work activities that are not classified as supported employment, if not paid, such as volunteering. And in this instance, this is coming, I believe, from a provider that we typically conduct 20, 30 hours of community-based work assessments which are unpaid. Does this mean they will no longer be funded?
No, we're not saying that it will be funded. We're saying that it's not considered supported employment.
Right. I'm sorry. There was a break in the question. That's what she wants to know. Is that so they currently receive reimbursement for it under supported employment, but you're saying moving forward that they would not be funded under supported employment, but they'd be funded as maybe a separate service.
Yes, it's pre-vocational most likely.
Okay, great.
Vocational or possibly small group, depending on the size of the number of people that are working in that. But yeah, assessments would fall under pre-vocational activity.
Wonderful, thank you. Okay, shifting gears a little bit to money follows the person. We have a participant here who'd like to get a little clarification about what money follows the person can pay for and what the waiver can pay for, and how those are distinguished in a state that has both. And where does IVRS come in? I think you've answered the last part of that question, Colleen, but I'm wondering if you and or Jeff have some thoughts about or guidance for states that really want to maximize both their waiver options and their existing money follows the person program to promote integrated employment outcomes.
Well, coming from the MFP side, basically when we're working with individuals who become MFP participants, number one, they're coming from an institution to begin with. That's how they're eligible. And on Medicaid, we have two budget areas. We have a demonstration service and we have a supplemental service. The demonstration service is the area where it's what Medicaid pays that is allowable within Medicaid services-wise, whereas the supplemental, it's not. It's an area where Medicaid doesn't cover it, but the MFP program will be able to cover it. For example, this is just an example. When we're transitioning individuals to an apartment or to a home, usually they need the first month's rent up front. Well, Medicaid doesn't pay that, but MFP can pay that. So the uniqueness of the MFP program is that I'm not going to say we can pay for everything that Medicaid doesn't, but for the majority of the unique circumstances that do come up, there's quite a bit of things in there that we can pay for that Medicaid doesn't, because we have to make sure that the individual is being able to transition in the community successfully. That's the uniqueness of the MFP program, because it's a demonstration. It's to show what the services are needed for the individual in the community, if they can get everything that they were getting in the institution versus in the community. And it also depends on their level of care going out into the community. I don't know if that actually answers the question as to what, but I know when individuals transition out into the community, the states follow up for 365 days after the first day of transition. But before they transition, they have to, the states have to make sure that there's a waiver slot available for that individual to transition to, because otherwise the transition will not occur without the waiver support being in place. So I think it really depends on the state's waiver applications as to what they have in the state waiver areas. I mean, they may be serving, for example, some states have several waivers, and they're serving the physically and disabled population, or they're serving the elderly population. So it's a state by state as to what their waivers are at their state capacity of what they're willing to pay or able to pay. And I don't know if Colleen can chime in more on the waiver side, but that's how it works with the MFP, is that no one transitions into the community until the individual has been confirmed through the waiver, accepted through the waiver program.
Jeff, I think thanks for clarifying that. And I think most people on the phone are aware of that element. I think what the question might have been attempting to ask, and something that we get asked a lot, is for states who have a money follows the person program, and they're into the program, they're starting to have some success. How can they leverage those resources to support the employment goals of those individuals, and do that in step with whatever waiver supports an individual or group of individuals are already receiving? We know that we know there are states that have had some good success or limited success with using the MFP resources to help promote employment, but I think states are really interested in hearing about those successful strategies. So are there resources or information that CMS could provide on some of those examples?
Yeah, it's actually on the slide. There's I forgot what slide number it is, but it's on the slide where I talked about there's a link on there that there's a comparison between MFP employment support and the waiver employment supports, and it aligns what MFP can pay for and what the waiver can pay for. For example, if someone would need to go into the community and they need a home modification, they need a ramp, or they need a car modification, they look at, and MSP portion to see what can be done to make that work, and utilizing other resources, whether or not it can be through the waiver or whether or not it can be through the assistive technology program. So there's other resources, even including the BR program, who may be able to play a role into that area as well. As far as job coaching support and job supports, we're really relying on the waiver community supports through the Information Bulletin that talked about the job coaching support aspects of that. I don't know if that quite answered that question.
That's helpful. Thanks, Jeff. Colleen, did you have anything else you wanted to add?
I just wanted to I guess, reemphasize that the list that Jeff's talking about gives examples of how states have used the rebalancing money to support individual employment outcomes.
Yeah, good point, Colleen. The rebalancing fund, that's the fund where states are collecting money, so to speak, through the savings when they are transitioning individuals from the institution to the community. There's an amount of money that's being saved for the state, and that amount of money is actually translated as the rebalancing fund. The rebalancing fund is technically state funds, but the state has to report to us how they are using that fund. For example, it is emphasized in our policy that the rebalancing fund cannot be used for roads and bridges and other state infrastructure. It must be used with the concentration in the home and community-based services. So if an individual has been transitioned out into the community and some time has gone by and they need some other assistance in the home that was not necessarily maybe picked up early on or was developed later on, that something has occurred and that they need assistance in the home, that the rebalancing fund can play a role to help maintain the individual to remain in their home rather than go back and be reinstitutionalized. So the rebalancing fund is a very unique avenue of funding sources that could be used to keep and help the individual maintain their independence in their home at whatever service is needed.
Great. Thanks so much, Jeff, for that. A couple of additional questions, but before we do that, I want to just jump back to the outcome-based payment strategies and milestone payments. Colleen, can you clarify if states are interested in including job coaching as part of a milestone payment or a tiered payment, outcomes-based payment process, similar, for example, Oklahoma has a pretty interesting outcomes-based model, and job coaching is a part of that. Is it your impression that that's would be an allowable or an appropriate milestone or outcome to have in a tiered payment structure?
Yeah, we'd have to really look at it on a case-by-case basis, but unfortunately, Oklahoma isn't a good example to share, just for the mere fact that they didn't specify how they're doing their outcome payments in their in their waiver application. So it's not like I can point you to Oklahoma and say, look at their waiver application. The language is in there. It's a good example. It's not written in the waiver application, so I can't really point to that as a best practice. But again, just in general, of late, we have come to the understanding that it's really important to be able for states to pay outcome-based payments, and so we're looking at various different ways that we can allow that to happen within the current regulations, statute, and guidance that we have.
Great, thank you. We have we received a question from one of our participants related to Ability One contract jobs that individuals with significant disabilities may be participating in. The question is, does CMS recognize Ability One jobs, whether they be service or product-oriented, as integrated employment, and can waiver money be used to support these jobs?
CMS does not take a position on Ability One contracts. We simply don't want to get in the middle of Department of Labor work. That's really Department of Labor's area of expertise, and so we don't want to dabble in it. It's up to the state to look at the criteria that are listed in each of the different core service definitions and determine which category Ability One fits in best. And it could be that an Ability One contract for one provider looks very differently than an Ability One contract for another provider. So, for example, perfect example here in the state of Maryland, I know that we have some Ability One contracts where individuals are cleaning buildings when the buildings are closed and there are no employees in the building, and therefore they're not integrated with individuals without disabilities, versus an Ability One contract where they're cleaning the airport, where there are face-to-face interactions with people without disabilities all the livelong day. No matter what hour of the day you go to the airport, there are people without disabilities that are in the airport that people are interacting with as they're cleaning. So it's really up to the state to make the determining factor on a case-by-case basis which Ability One contracts will fit the bill for supported employment versus group-supported employment versus pre-vocational services.
Thanks so much for sharing your perspective on that, Colleen. That was most helpful. We also have received a question for you all. What are some creative ways or approaches that states are providing for meaningful wraparound supports for individuals who may be employed less than full-time, but that does not include spending part of the time in a segregated day habilitation or segregated pre-voc services?
That is the question of the day. That there's going to be much more guidance that's going to come out on that in follow-up to the HCBS rule that will be effective on March 17th. We have a non-residential work group that is working on providing sub-regulatory guidance, and Jeff and I are both on that work group, where we'll be providing examples of places that may meet the home and community-based settings criteria and those that may not, and what some of the individual criteria are for looking at each individual's circumstances to determine whether or not it's the most integrated setting for that particular person. Did that get at your question? I'm sorry, I might have gone off track.
No, that's perfect. It does. And for states, I think this was brought up by a state who's probably thinking sooner than later about proactively including any strategies or thoughts into an upcoming or imminent waiver renewal application. And so do you have any examples to date of states that kind of maybe proactively infuse some strategies through their waiver or state options that you would, or state plan options that you would highlight?
You know, at this point, it's still in the information gathering phase.
Sure.
And we got recommendations. We spoke with multiple different stakeholders as part of our work on the non-residential work group, and they offered some suggestions for best practices of particular states and or providers. And we feel like it wouldn't be in the best interest interest of anyone for us to simply just pass along the name or the state or provider to individuals without us researching it first. So we're looking into how we can get really good evidence-based practices information out there in the hands of providers. And I can tell you that some of the services that I've seen personally in my goings on around in the country are settings where individuals are in the community when they're not working, spending time either sharpening their work skills, sharpening their social skills, sharpening their independent living skills. They are exploring other job opportunities that may meet their interests better. They are volunteering. They are spending time doing what you and I would do if you and I were all of a sudden tomorrow to become unemployed. What would we be doing? And I would dare say that we probably wouldn't be bowling for very long because bowling doesn't pay the mortgage. Now bowling may be appropriate for some people. That may be the social activity that is appropriate for someone. But people who are of working age should be focusing on work-related activities to the extent that it's appropriate for the individual. And again, I'm going to go back to the person-centered planning because I think that's so critical in all of this. But, you know, there are programs that are out there that are doing van therapy, and we know that. There are programs that are out there that are sending folks to bowling alleys or to malls to do mall walking all day long, and we know that. They are not necessarily best practices, and we would not probably promote those types of programs. If they are a program where the individual is, let's say, meeting in the morning at a bakery with a couple of friends that they like and that they choose to go to the bakery with, and then from there they're spattering out and going out and doing different things that meet their specific interests. So maybe one's going to volunteer at a soup kitchen, one's going to work out at a gym, one's going to a doctor's visit, you know. Maybe one person is going to a part-time job, and then maybe those folks gather back at the bakery later that day, or they gather at the library later that day. But it's about the community, being in the community, doing community-based activities that people without disabilities are doing. That would be considered a best practice. I can tell you that just off the record, because that hasn't come out in guidance yet. But I think that we all here at CMS believe that that would probably be a best practice.
Fabulous. Thank you for that. Couple of other questions. Can you give any insight to the Medicaid billing process for fee-for-service states?
Can you repeat that again?
Sure. It says, can you give any insight to the Medicaid billing process for fee-for-service states? Is that, yeah.
I'm not really sure what that means.
Yeah. I had it at the end here because I wasn't real sure either if it was applicable.
I'm sorry, I'm not real clear on what that means. If the person that asked the question could give us more details, that would be really helpful.
Great. Okay. We will follow up with them. Another question, so one of the big, I think, concerns that states have is, you know, if they're transitioning the focus of the types of services they're financing to ensure that people are receiving services in the most integrated setting, what kind of steps or assurances do they need to take to ensure that these individuals that are being transitioned from perhaps a segregated setting, whether it be segregated work or segregated pre-voc or day hab, will have complete access to qualified employment vendors who actually know how to help them achieve integrated employment in the community.
I think that that is a tough challenge for the state, each individual state, to develop that capacity for really good qualified providers. You know, CMS looks for an assurance that the states are providing good qualified providers and that they are meeting their standards that they've set, that the states have set themselves for ensuring that the providers are meeting certain qualifications. You know, it's a tricky one. It's a tricky one. I think a lot of it comes down to good training and technical assistance. I know it's an area that ODEP is focused on. It's an area that we intend to focus more intently on in the coming years as states work on the HCBS rule. But training is really the key, and you can't simply hire someone and send them out into the field to do good work and expect them to do good work. They need to be mentored and really shadowed for a while before they can be cut loose and expect to do a really good job.
That's a great point, Colleen. And as a follow-up, kind of subset question of that, could you speak a little bit to the individual supported employment service definition that was in the 9/11 or 9/16/11 bulletin, and some of the things that's allowed there, such as customized employment strategies and other things, just so that states really have some ideas for how they could utilize that service definition to encourage and incentivize providers to focus on developing expertise in key practices.
If I understand your question correctly, I think what you're asking for is what are some of the best practices in providing employment supports that could be provided through through a waiver that may not necessarily cost money?
Well, not that may not necessarily cost money, but that would be allowed under individual supported employment services under the waiver. So yeah.
Let's see. So for example, coworker supports. Is that an example of what you're talking about?
That's an example. Yes.
Okay. Good. I'm on the right track then. Coworker support models are a really good resource for states to use to expand the capacity of job coaching. So, coworker supports are supports that are provided by a coworker that does not presumably have a disability, that works in the same workplace as the person that has a disability. And they are basically responsible for sort of assimilating the individual into the workplace, you know, inviting them to lunch, showing them where the lunchroom is, showing them where the punch-out clock may be, that kind of thing. It's the job coach's responsibility to actually teach the individual their job and then to link the person to someone like either a natural support, which would be the ideal situation where you're not paying for them, or a coworker where you may pay the coworker a stipend for providing the support that I just talked about, like making those natural bridges, bridging that gap. Coworker support models can be funded through the waiver. And you could use it, again, as a supplemental service, or you could use it as a subcomponent under supported employment rate. And I've even seen there's one example, and I'm sorry that the state's escaped me right now. There's one example of a state I want to say it's Oregon, that actually has a coworker support service written into their waiver. And I'd have to look up that information, so I'm giving you the accurate information and the exact waiver. But there is a waiver that has coworker supports as a separate, distinct service, which is pretty cool.
Great. Thanks for that, Colleen. And there's other practices as well, correct? Like discovery and customized employment services, I'm assuming?
Sure.
Mm-hmm.
Yeah, customized, you know, I get hung up on the words here because Marilyn called it the opposite of what it actually is. It's customized employment, but customized employment is a really good strategy that works particularly well for people with very significant disabilities. It's really matching the individual's strengths and interests to the needs of an employer and making a really good job match. It's like job carving in the 80s and 90s. We used to call it job carving. But that's basically what it is, customized employment. It works really well for people with, in particularly with significant disabilities, those that can't speak for themselves perhaps or have physical disabilities, and have trouble communicating. Self-directed models are another model that work really well for employment supports. So instead of hiring a provider, and providers, all close your ears, the individual could hire the next door neighbor or, you know, a coworker at an employment place of employment. To provide their job coaching for them. It can be done. It has been done. It is done now today. So self-direction is a really good model that people should take advantage of if they have the opportunity and the supports to do so. Peer support is an excellent model particularly for people with mental illness, but not just for that population. Let me be clear about that. Peer support is just plain a good model. It's peers that are training other peers. It works well. For example, when I started working at CMS, I was assigned a mentor who was a peer who really showed me the ropes. They showed me around the job. They showed me where the cafeteria was, where the post office was, blah, blah, blah. I could go to them. They were my go-to person for all things brand new to me in the world of CMS. That's a peer support, and that's a support that's not paid. But peer support sometimes can be paid. Let me be clear about that. It is allowable to be paid under the waiver, but sometimes it's not, and it's just a natural support, and it's a wonderful support. So those are some examples. I, of course, would be remiss if I didn't mention self-employment. Self-employment is a wonderful option, particularly for people who have significant disabilities, who a typical job may not work well for. I've worked with a number of people with autism that just had difficulty working around other people and in environments, in busy work environments. And I can think of one example of a guy that set up a print shop with the help of his high school teacher, and then from there he continued with that print shop job after his high school career was over. And he continues this day printing all kinds of T-shirts and mugs and hats and you name it, and he does it. So self-employment is a really good option as well for folks to consider that sort of not the ordinary, if you will.
Those are some wonderful examples of effective practices, Colleen, and I really appreciate you spending some time kind of given us your sense of some key effective practices. I think that was really important for all of the participants to hear, especially those that are intimately involved in their state's state waiver renewal application process or state plan, to really think about how to infuse those strategies. So thank you so much. That was excellent.
Serena, this is Jeff. If I can add two quick things here. Yeah, I failed to mention earlier in my presentation and regarding MSP, just so folks on the call know that as of December of last year, December 2013, we have transitioned a little over 35,000 people since the start of the program, 2007. It may sound like a low number, but it takes several years for states to get the infrastructure in place. And it really picked up within the last 2 years. We've really gained momentum in transitioning folks in the community. That's the one point I want to make. The other point is regarding the BIP, the Balancing Incentive Program. Two areas I just wanted to clarify, and we can go two ways with this. For states that are on the call that are aware that you have a balancing incentive program, I would strongly encourage you to, if you don't know who the project director is handling the grant, you should be able to find it on your state's website. They usually post that kind of information. If for some reason you can't locate that information, please let us know. That the reason I'm suggesting that is that you can always go to the project director and ask the balancing incentive questions that you have. And also utilize Effie George and Carrie Lita, but mainly Effie George. Serena, this is just an idea, and I'm not speaking for Effie here, but maybe something worth similar to this call if you want to coordinate something, if you have a strong need from the states, needing some kind of little bit of an orientation or something regarding to BIP and how it relates to all the system transformation. I'm sure Effie won't mind coordinating that and be glad to be of assistance, but we can communicate with her and I can help you with that.
That would be fantastic. I think we would welcome that opportunity. You guys are doing so many great things. It's hard to get all your good information into one call. So we absolutely would be delighted to host some additional webinars beyond this two-part series. So I'll definitely be following up with you on that, and I appreciate you not only making the offer, but signing Effie George.
I mean, we'll work together on that. I mean, I'm sure it's scheduled, everybody may take time to schedule that, but it is important for stakeholders and providers to understand the connection where the BIP program has a huge impact for states, especially for states who have MSP and the waiver. You got all these waiver authorities, you got MSP, and you got BIP, you got all these grant programs and how they work together. And not duplicating services is a huge task for states, but it's certainly a win-win for those states who do have all three.
Thank you so much for that. Colleen, we had a couple of follow-up questions pertaining to how the coworker idea could be infused into a waiver or could be paid for. The first is whether or not a coworker structure could be used to give funding to a current employee at a job to aid an individual or a colleague with a disability, or could it be used to fund an additional staff person to work alongside the individual?
Well, the purpose would be to fund a coworker, a current employee at the job, to support the individual, and it can be paid for with waiver funds So, for example, if the state gives provider A $10 an hour for job coaching, the provider could then subcontract with that coworker through a subcontracting arrangement and pay that coworker $1 or $2 extra an hour in addition to their salary that they're getting from the employer to provide the coworker support.
That's really helpful. Thank you. The other question about this is whether it says, are you aware of any states paying a coworker as a natural support or using the peer worker support model? I think you spoke a little bit about peer supports, but can you speak a little bit to the first part of this question about paying a coworker as a natural support?
Well, let me just say that the way I view it, and this is just Colleen's world, I see a very large distinction between a natural support and a paid coworker support. A natural support is not paid. It's a coworker that's, out of the goodness of their heart, has offered to provide some supports to the individual, to get them through their day. That's a natural support. A coworker, paid coworker support is where you're actually paying a coworker and they acknowledge that they're receiving payment for the purpose of providing that same service to the individual. So I see a distinction there. That's the way my little world sees it.
That's a great clarification and way to describe the two distinct phenomena. So thanks for sharing that. I think we just have one or two more questions before we wrap up. One question that we received today prior to the presentation, and that I know is a question you get a lot, which is around time limits. And as you so eloquently described in your presentation, CMS was very clear in its informational bulletin that pre-vocational services should be time limited, but really did not put in motion a set time or establish an actual quantifying criteria in that for states, and really left it up to the states. I was curious and pleased to hear you also mention in your presentation that CMS, also views group-supported employment services not as a long-term endpoint, but as a transition place, a place that you go and you get some training and experience, and you hopefully move on to other things. So my question for you is, for states that are in the process of trying to figure out either phased progression of activities or time limits that they want to put into place for these services, are there any specific criteria or standards or things that you'll be evaluating applications that come in based on, just to give states somewhat of a sense of the types of factors you'll be looking at to determine whether or not the time limits that they're proposing are consistent with the spirit of the informational bulletin?
Well, for example, we had a state that came in with a 5-year time period for pre-vocational services. And so, my response to that proposal was, why does it take you 5 years to find an individual a job? If the individual says they want a job, then you need to shore up your resources so that individuals can have a job. And I'm not saying that that's easy. Believe me, I've been there and I've done it. I worked for a provider agency that closed down a sheltered workshop, so I do understand the intricacies in doing that. It's not easy. But 5 years is a little out of the ballpark, I think. I don't think that's realistic. there are some states that have come in with 12 months, some that have come in with 24 months, some that came in with, I think Maryland, if I'm not mistaken, is 6 months. I should know, I wrote it, but it's been that long ago that I wrote it that I can't remember, but I think it was 6 months. The bottom line is that it should be a short-term gearing up period for the individual where they're learning some intense employment skills so that they can go out and get a job in the real world. And not that they, again, linger on forever and a day. So I guess one of the things that we'll be looking at is what is the time frame, and is it realistic? 2 years, maybe that's a stretch, and maybe that might be acceptable, but if there's an individual who says they want a job and they are ready to work, ready to roll, you know, maybe they're just out of high school and they say they want to work, then the goal for that individual should be work. It should not be pre-vocational services. You have to meet the person where they are. I hope that helps.
That's really very, very helpful. Our time is up. I really cannot thank the two of you enough for your time. I know, actually I can't even fathom how busy you and your respective teams are at CMS these days. So it means a lot to us that you made yourselves available for this national dialogue. I'm hoping that folks on the phone got as much out of it as we did. I know that we get so many questions related to all of the exciting policy developments coming out of CMS on a regular basis that we thought it was absolutely essential to host these sessions. So I thank you both very much for your time and expertise today. It was just really incredible. I want to encourage folks that are on the phone today, if you have not already registered or signed up for the second webinar, which will be hosted the same time next Thursday, a week from today, from 2 to 4 p.m. Eastern Time, please do so as soon as possible. There's limited space available, and please submit your questions. The topic of that webinar is going to be focused on the final HCBS rule and some general information around that. So please submit your questions. As Colleen said, she'll be back with her boss, Ralph Lawler, from the Division of Long-Term Services and Supports. And until then, I hope everyone has a great week. And thank you again so much, Colleen and Jeff, for your time today. It was really exceptional. Greatly appreciated.
Thank you. Our pleasure.
Thank you, everybody.
Thank you. Take care.